The answer to today's NCLEX question on cerebral arteriography. A client returns to the unit after a cerebral arteriography. To learn more about cerebral arteriography, see the link in the description. Which interventions does the nurse perform in the immediate post-op period? Select all that apply. The answer is A. Maintain a pressure dressing over the insertion site. A cerebral arteriography is used to visualize the blood vessels in the brain. For a cerebral arteriogram, arterial access is usually obtained via the femoral artery. Maintaining a pressure dressing over the site is important to prevent bleeding, swelling, and hematoma formation. The client will be placed on bed rest, typically for 4 to 6 hours, depending on the healthcare professional's prescription. During that time, the client must remain flat and the affected extremity should be kept straight for the length of bed rest. If this content was helpful, like this video and subscribe to the channel. Share with someone that might find this useful. Happy studying!